Hi, welcome to Let's Talk About Tobacco. I'm Lee Keller, and I'm here with Janiece Davis, Dr. Barry Hummel, and Dr. Mike Feinstein. And we were talking about some of the risks involved in using different kinds of tobacco. Finished up with some things about policies and things that are happening in the state to fight secondhand smoke and different forms of tobacco and role modeling by our adults. And Janiece, you had a few more things to talk about with those?
Well, I think one thing that we haven't touched on yet is our young adults, the college-age students. And there are numerous colleges here across Florida going tobacco-free campuses. University of Florida was one of the first. They went tobacco-free back in 2010. July 1st, we had the University of Miami recently have a tobacco-free policy. University of South Florida passed a local policy. I know Florida State University is working on it, as well as Florida Atlantic University and Palm Beach State College. So having to take the kids from a smoke-free environment at their secondary and then going to a smoke-free college campus, I think it kind of continues the trend and perception that smoke-free environments don't just stop once you graduate and move on. Because think about it, here in Palm Beach County, we have only 9% of our adults reported being smokers in 2010. So to take the kids from high school, where they no longer see tobacco use among teachers, staff, visitors, contractors, and if you were to place them in a university in Florida that didn't have such a policy, it might create a disconnect to them, especially if there's tobacco-free parks, tobacco-free beaches, tobacco-free work sites, tobacco-free schools, but then you go to a college campus. So we're trying to work with our state university system as well to help create some tobacco-free college policies as well.
And it's really good.
Well, talk about perception. Very interestingly, we, American Lung Association, we have a program here in Palm Beach County called Lungs for Life, which is mostly a tobacco prevention program. And recently, to give the students an idea of perception, I've been asking the middle school students and the high school students the question, how many of you in the class think that more than 50% of your middle school or high school peers, whichever, are active smokers? And overwhelmingly, 100% of hands go up. Most middle and high school students perceive that more than 50% of their peers in the state of Florida are smokers.
Is that true?
The actual statistic is middle school students, according to the Florida Youth Tobacco Survey from 2010, about 5% of middle school students have actively smoked within the past 30 days, and about 13% of high school students have actively smoked within the past 30 days. And that's an important concept for these students because many of them think that they're out of the mainstream, that they're geeks or dorks because everybody else is smoking and I choose not to. And the fact is,
they're not.
95% of middle school students are not actively smoking in Florida, and 87% of high school students are not actively smoking in Florida.
I did the same type of survey in Martin County, and I surveyed 1,200 middle and high school students. They thought the average percentage of adults that smoked was 62%. I just told you in the state of Florida it's only 17%.
Yeah.
They're not seeing 62% of adults smoke. So where's that perception coming from? And if they think that 2/3 of adults are smoking, they're going to be more inclined to make that decision when they're confronted with it. They're not going to say, well, maybe this isn't something I shouldn't do. They're going to say, this is something everybody does. It's what I'm supposed to do to fit into that adult world. So changing that perception is really a critical thing. Tobacco-free policies in outdoor spaces goes a long way. Because think about this. Before they put the Clean Indoor Air Act in, everybody smoked at their desk, and they smoked inside the restaurants, and they smoked off the streets. So when I rode my bicycle as a kid, I didn't see any adults loitering outside smoking. Cut to today, where we've pushed all the smokers outdoors and hovering by doorways and in outdoor spaces, and now when somebody rides through the community, everybody standing outside when it's 95 degrees in Palm Beach County is smoking. There's no other reason to loiter outdoors in a public space anymore. And so now the kids are seeing an enormous number of people outside smoking, and that may be one of the things that changes that perception. You know, if I stand at a restaurant waiting for a table and there's 5 adults out there smoking with me, my kids go, 5 smokers and 1 non-smoker. That's why they guess so high. And so it's incredibly critical that we start to maybe break up that notion that you stand right by a door or you stand in a cluster. That may be another policy we need to look at to change this perception piece that Dr. Feinstein just
It
mentioned.
would also make it healthier for when you enter a restaurant if you weren't going
sure.
through a smoke screen.
Right.
Well, that's your billboard. Is that how you want to advertise your restaurant? You know, you pay all this money for a big fancy facade and some beautiful plants and a water fountain and then 8 smokers. And is that the advertising you want to make your restaurant appealing? We all know nobody inside is smoking as adults. The kids aren't transporting themselves inside the restaurant and going, oh yeah, there's 100 in there and there's 5 out here, so maybe it's only 20%, right?
Yeah.
They're seeing a cluster and thinking everybody must be doing it.
Right, especially if you have outdoor seating where the people are smoking outside, so all you see outside are people who are smoking at the restaurant, not noticing that the people who are inside way outnumber the people who are outside, but you're seeing the people outside because that's where you see first.
One of the big improvements now, I think, is smoke-free campuses for hospitals. I remember when I was going to hospitals on a daily basis as a physician, I would go into the physician's entrance at the hospital from the parking lot, and if it was a kind of day where I got a little disoriented, I'd know exactly where the physician's entrance was for the hospital, because there'd be residents, interns, healthcare providers huddled outside, and there'd be a cloud of smoke over that doorway entrance. And if you missed the stars in the sky, you could always follow the smoke and get into the
That's
hospital.
amazing that healthcare experts
Yes.
would be
Addiction
using
is addiction.
tobacco.
It doesn't matter what you're back. Remember, most people start when they're young. They made this decision way before they were a healthcare worker. They were probably 14 or 15. Now they're a nurse at 32 and they're addicted to this thing and can't give it up. So part of what we're dealing with is how do you handle a true addiction in a fair way for an adult who actually made a bad decision when they were a teenager.
Right.
An underinformed, naive decision, let's call it that. Not necessarily we want to say it's a bad decision, but you didn't have all the information, you made this decision, now you're kind of stuck with it for life. And so there is that accommodation and that kind of care and compassion you have to have for people who are addicted.
And especially when they start at, say, at 11 or 12, when their brain's still developing much more than, let's say, a college-age student who picks up the habit at 18, 19. So between that 8 years, there's a lot of development that's going on in your brain. So when you start at 11, think about the damage that you're doing to your brain versus somebody who starts in college. So even that right there shapes how the brain becomes addicted. And I think people tend to forget that it is a true addiction, and that's why we're not anti-smoker ever. We want them to recognize that for the youth, how the tobacco industry manipulates them into beginning this addiction, and for adults, how the products are manipulated to keep them addicted to it, but also try to focus on helping them quit with the Florida Quit Line and other available resources too.
That's one thing that we have in Florida that I really like. We have a lot of services available to help people that are addicted to tobacco get unaddicted. They can get off of the bus.
And it's been common knowledge, basically, that the addiction to nicotine and tobacco is such a powerful addiction, and some articles, some very well-written articles, say that it's as addictive, if not more so, than heroin or cocaine. So when
I've read
people
that,
have
yes.
difficulty stopping their nicotine addiction, their tobacco addiction, it's not their fault. They are truly and very seriously addicted.
There was an article in Pediatrics in May of 2011, and especially as a pediatrician, Dr. Hummel mentioned how pediatricians are very instrumental in keeping young people from picking up the habit. So having healthcare providers recognize that it's important to ask their youth or patients, are you a tobacco user, advise them to quit if they are using tobacco, and refer them to necessary products. But I think that there has been a gap, and I've seen it before in some of our clinics, where we tend to not really address the issue of tobacco because they feel it takes too much time, and you only have X number of minutes with each patient. But
There's a lot of issues, and getting it in is really tough. In fact, when we come back, we're going to talk about some of the social impacts that tobacco has on society today. So we'll see you in a minute.